Dr. Tom has been voted by you Best Cosmetic Surgeon for 9 years. 9 years! And his team has gotten Best Aesthetician for 3 of the last 4 years by Press Democrat readers. So congratulations, Dr.
Thank
Tom.
you, Michelle.
It is pretty great. And of course, you can always call to book a consultation, get some more information if you're curious about the things that you hear on Dr. Tom's show. Today, we're going to be talking about microneedling with Nurse Jessica Allen. She'll be giving us lots of great information. And we want to let you know before we get into the topic that Dr. Tom is running a special. You can purchase one area of microneedling with PRF and get a second area of treatment for free. And those areas could include maybe the neck, chest, or hands. Pretty cool. So welcome, Dr. Tom.
Thank you, Michelle. It's great to be here on this lovely day in Sonoma County. And I want to thank Jessica Allen for being here. Hi, Jessica. How you doing?
I'm doing well. And I want to say I have an extra special happy birthday to you today, Dr. Tom. It's a very special day today.
Okay, I didn't know we were going to broach that subject. So I thank you. Listen, I am grateful for every year I get. I'm collecting as many as I can. And life is good.
Yes,
life is good. So thank you. Our team surprised me last evening. They kind of cornered me, and I was supposed to be doing some accreditation stuff, and I came out and they had a big party for me. So we're kind of, my stomach's full, and I feel very grateful for such a wonderful team that I get to work with every day. So thank you.
Oh, well, we're grateful for you, and it was a great time, and we really got them good.
Great, thank you. You did. You got me. All right. So Jessica, this is your second time on the show with us.
It is.
We've been very excited. I know that initially Jessica was a patient of ours, and our lead nurse Mary and I, we were recruiting her for how many years were we recruiting you?
About 2 years.
About 2 years. Yeah, we were pretty hard on it. We finally got through. We got through, and we got Jessica to join us. And so Jessica, it's always great to have our newest team members. You're not a new nurse, but our newest team members in terms of getting out information. This is an educational show and getting out information to our listeners. And I want to thank everybody for listening to us here on KSRO. And so Jessica, today I wanted to talk a little bit about microneedling. Right. So why don't we start off with talking a little bit about what it is, then we'll talk about why we do it. But I think that the listeners, if they haven't been listening to us, need to know what microneedling is.
Sure, right. So microneedling is a really great treatment if you're looking for collagen production. So that's something that really is on the trend right now, is trying to find ways that's going to help us create our own collagen. So this is a great treatment. It's really good at focusing on textural issues in the skin. And essentially what it does is it's a little device that creates little microchannels in your skin, targeting the dermal layers, which is where collagen's produced. And this treatment is really, it helps to give you that more youthful, radiant glow. So it's a great treatment. It's very popular, and people really enjoy the results.
It is amazing. It's just climbed up the ladder of frequently performed cosmetic treatments. So as you mentioned microchannels.
Yes.
What it is specifically is a handpiece that you mentioned that has multiple little needles in them, about 20 plus, okay? And so what we do is we put on a topical anesthetic on our patients so that they're numb, because I'm the president of the weenie club, Jessica. I don't like discomfort, but I'm an empathetic weenie. So we want to treat our patients really well, so they put on a topical anesthetic.
Yes.
How long do we let that topical anesthetic sit on the patient?
We're going to let that stay in place for 30 minutes, so you're nice and numb, and it really helps to just make the procedure a lot more comfortable. It's not really painful. It's just kind of more irritating. It could be a little irritating, like a cat tongue scratching you.
Okay, so we put the topical anesthetic on, and then we take this handpiece and we glide it over the face, and it's making these little, as you said, microchannels.
Yes.
You can tell that Jessica's trying to make this sound microchannels. What exactly does that mean? Well, actually, think about aerating a lawn. Or I'm not a golfer, but I golf once a year. But when you golf and you see the greens and you see these little holes in them, what are they doing? They're aerating the lawn, right?
Yes.
Okay, so basically we're aerating the skin. You're making these micro punctures there. And so what is this concept? We talked about this on the way over here.
Right.
We talked about a term called collagen induction, right? So
yes.
we're inducing collagen. And this goes along with our kind of our direction of biostimulation.
Yes.
And this is a trend in cosmetic medicine, and I really love it because I used to be an organ transplant surgeon. So studying our own immunology, how our body heals, all of these things that are very important in that field, we're now taking that and we're using it in the world of cosmetics. We're trying to stimulate our own collagen. So tell me what happens? We're aerating the face, or
yes.
we're making these little micropunctures. How does this induce collagen?
Right. So when the micro needles are run over your skin, it's creating these little holes at different depths based on the thickness of the areas of skin that we're treating, and it's tapping down into that dermal layer. And what that does is it's going to stimulate a wound response in your body's own immune system. So that's the wound response in that layer, is to produce more collagen to heal those little micro injuries, if you will.
Okay, so and that's important. So you use the word wound, and
Mm-hmm.
sometimes when we're marketing ourselves, like we don't want to use certain words, but I think that's important to understand
Mm-hmm.
from a scientific standpoint, is that a wound has to heal.
Right.
So it might be a scab on your knee when you're a little banshee running around in the summertime and you get a scab, and you skin your knee, and the scab is part of that healing process. We do know, for instance, a lot of times if we break a bone when we're a little kid, that the bone heals. So that's an injury, and the bone heals.
Right.
And in some ways it can even be stronger, right?
Right.
It can be
Yes.
even stronger. So it's that same concept of stimulating our biology to heal. Okay,
Right.
so the process is they come in. How long can they expect to be in the office for microneedling?
It's about 2 hours. You're going to come in, and we want to get you numb first thing. So we will have you come in, we get you in the room, get you comfortable, and we're going to apply that numbing, topical numbing cream to your face and let that sit. During that time, we're then going to add another part of the treatment, which is called PRP. And what that is platelet. We're going to be drawing your blood, and we're going to be extracting the platelet-rich plasma. So when we do that, we're just drawing the blood. It's one vial. We put it in our centrifuge to separate the red blood cells from the plasma. We extract that, and we use it during the treatment. So we're doing all of that while you're numbing, and then we give you just some time to relax and just kick back, get nice and numb. And then we come back into the room after 30 minutes. We're going to clean your face really well. We're going to remove all that topical numbing cream, and then we're going to start the treatment.
Okay, so you're using the PRP,
Right.
and so we're for our listeners. So you're drawing blood.
Mm-hmm.
One thing you should know, Jessica said about 2 hours, and I'm kind of thinking an hour and a half, but it's an hour and a half, 2 hours. You have to understand, at our office at Dr. Tom Cosmetic Surgery, is that we give you a lot of time. A lot of offices you go in to have, for instance, Botox treatments, and you're in there for 10 or 15 minutes. We actually set aside half an hour for you. And yes, the procedure takes us about 5 minutes to do, but it's because we want to evaluate the patients.
Right.
We do this because we like our patients and we want to talk to our patients, and we want to make sure that they don't feel rushed and that we're doing a good job for them. So you do have to know, we do spend a little bit more time with you, but you do have to know that this isn't something you're to come in for half an hour and be out the door, because
Right.
we're inducing your collagen.
Yes.
We're not going to induce your collagen in 30 minutes, okay? So this is going to take a little time. So we're using PRP, and what I like, so we're putting on a topical anesthetic. We're doing the microneedling, creating these channels. These are wounds, and then your body's going to start to build. It's going to build from the inside out, collagen for you. Just microneedling alone is helpful, but we wanted to boost it. So what we do is draw off that PRP that
That's
you
right.
mentioned, and by placing it on the skin, it can now penetrate into those tunnels.
That's right.
Okay, those tunnels, and it can help to facilitate that collagen induction. And I like to call PRP the paramedics of the body. And so as a paramedic of the body, it goes to an area of injury and helps it to heal. And I talked earlier about wounds, and I talked about skinning your knee. And
Yes.
so I use this commonly when people want to know what PRP is. So we've all been kids running around, and we scrape our knee, and because we're wild banshees at summer vacation, we're out there and we're still running around, and we knock our scab off, right? And we're sitting there out in the lawn somewhere, and we're looking at our knee because we just knocked our scab off. And you'll notice you see this yellow kind of fluid coming up. I see Michelle's you're shaking your head. Have you had that experience,
Yeah,
Michelle?
yeah, for sure.
Yeah,
I mean, even more recently when I fell off my scooter.
Oh, okay, all right. right.
ago. I saw that too. Yeah, that was my
So there you go. So I think it's a universal phenomenon. Have you had that? You're a baby.
Yes.
You've had that happen to you
Oh,
too.
yes,
Okay, so
yes.
we'll have to ask some of our Gen Z staff members if they've seen that. But the scab comes off, and you look at your knee, and you see this yellow fluid coming up. Okay, that's your serum. That's your platelet-rich plasma coming in to heal, and then it's going to scab over more, and eventually it heals. Okay, so we're using that same concept. We're placing it over those microtunnels that you created. Okay, and it goes down to help to facilitate more collagen. Okay.
Can I ask a question?
Sure.
So I'm thinking that you're doing a couple different things at once here. Of course, the ultimate goal is to stimulate the collagen, but you're putting the PRP on top. But as you're making these channels, these little holes, isn't that your body thinking, oh, I got to send some more PRP to that place, so it's coming from the bottom and the top of your skin?
That's
Correct. Absolutely.
exactly
Okay,
right.
I'm sorry. I'm going to
Exactly
leave
right.
right now because
like-
I'm going to let Michelle. Michelle and I have been working together for decades, and I'm just going to let her do the rest of the show with you, Jessica.
Yeah,
but no,
very
you're
well
absolutely
said.
right. So you would mount your own response, but we're kind of, remember I was a general surgeon my lifetime before, so if one's good, 100's better.
There you go.
And so that personality-wise, so what the heck? Let's hit it and let's really get that collagen going. So that's why we use the PRP along with the microneedling. And I feel that microneedling is one of the best treatments for improving the texture of your skin, okay? And it's probably one of the, in terms of spending money on cosmetic procedures, okay? You can spend thousands and thousands and thousands of dollars, okay? Call our office, they can give you the pricing on this, but basically microneedling is great because it's something that you can do any time of the year. It's colorblind versus lasers where you can't be tan, or if you're a brown baby like me, okay, or even darker, you have to be more careful with lasers. This is colorblind, and so you can do it throughout the year, which is what I love. Besides texture, so we're improving texture, we're building collagen. Jessica, what other things can you treat with microneedling?
So it's acne scarring. You can have even some discoloration in the skin. It can help with that. It's going to help just with the overall quality of your skin. It's just going to really improve and boost and give you more of that youthful, radiant glow.
Okay, so acne scarring you mentioned.
Yes.
Okay, so or any kind of scarring,
Yes.
this can help. I'm not going to tell you it's going to erase it. We don't want to mislead you.
Right.
But it absolutely, these little micropunctures, remember we're aerating that, right? Like on a golf lawn, putting green. So by doing that, we're hoping that when it heals, that it will heal with softer tissue, okay? And that you will get a softening of your scars. And definitely, it's a nice way to go. It's minimally invasive. There's really no downtime with this. And when you have this procedure done, your skin is plumped up.
That's right.
And I know that you just did this on one of our lovely staff members,
I
and
did.
that's our medical assistant,
I did,
Bridie.
Bridie.
And I have to say, she looks great. And she's a Gen Xer, and she looked like a millennial to me
She
when we
looks
got done.
amazing.
Right?
She looks amazing.
She looked great, and her skin, and she's of Irish descent. You can tell by the name Bridie,
Yes.
right? That her skin just looked more plump. And more youthful.
Absolutely. It even adds it just tightens the skin and makes it more plump. It just gives you that radiant glow. She looks amazing, and she really got great results.
She got great results
Right.
with that, and we were so happy for her. So you also mentioned, Jessica, that besides the texture and acne scarring, you mentioned pigmentation. Now, there's another treatment that I like, probably even better for
Yes.
just pigmentation, but I do believe, as you said, that microneedling can help to diminish pigmentation as well.
It can. It helps to it evens out the tones in the skin. It's broadband light is the treatment that's really going to target the pigment issues in the skin, but microneedling and BBL really go well together. So
Right.
it's great to target the different areas and with different treatments.
So if you're old enough, you know that there's never a single cure. There's no magic bullet that takes care of everything.
Right.
So as with everything in life, it's usually multiple things that gets us to where our goal is. So
Absolutely.
definitely multiple treatments in terms of different what I'm going to call complementary treatments are
Yes.
helpful. So the way that I would look at this is that microneedling is collagen induction, as you mentioned.
Yes.
Collagen induction, and it's going to improve your texture.
Yes.
Okay, and absolutely, I feel that it does. And by that, I actually think it can help increase the thickness of the skin as well.
I agree. Yes.
And it has become one of my favorite treatments to recommend for people, because I think it does a very, 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 very nice job. And especially for those who are looking for natural results, it's a great treatment. For those who are maybe low maintenance and they're actually not coming in enough to do things for themselves,
Right.
this can help to really jumpstart their skin health.
Absolutely. It's something that can just keep your skin looking youthful, looking plump. It's great complementary treatment to other treatments in the office and just your skincare. It's almost something that you could do for maintenance over time, just to keep your results lasting and keeping your skin in good condition. It's not really a fix-all. It's something to do over time that's just going to keep you where you want to be.
So I'm going to, I want to mention, when we talk about multiple treatments, and so I do want to, before the show ends, talk about why BBL or photofacials IPLs are important along with microneedling.
Yes.
But because you brought up about throughout the year and all, let's
Right.
just talk about how many treatments, so what can a patient do? They just come in and get one treatment and they walk out and look 10 years younger?
No, that's not.
Darn.
Unfortunately, there's not a one treatment,
let me-
one pill, one cure-all.
All right, let me
fix.
change the radio station. Forget it. Yeah, I don't want to listen to this guy anymore. Okay, so you can't expect just one treatment. What
Right.
is the recommendation?
Typically 3 treatments is when you're going to really kind of get to a point where you're going to see really, really great results. Each treatment is going to give you beneficial results. You're going to see improvements in your skin, but 3 treatments is kind of that magic number. And so when you first get into microneedling, you're going to want to invest in that 3 treatment kind of package, because you're just going to see the best results. And then after that, sometimes it's more of just kind of finding a good maintenance schedule for you throughout the year, every 3 months, every 6 months. It's just dependent on what you're hoping to achieve with your skin.
So initially you're recommending 3 treatments.
Yes.
How spaced, how far apart?
About every 3 to 4 weeks.
Okay, so you're saying, let's say once a month
Yeah,
approximately.
a month apart.
And so you go through your 3, hopefully you're going to love the results.
Yep.
And so do they have to do a series of 3 in another 6 months to a year, or are you talking about a single treatment at 6 months and a single treatment in a year?
I would say you could probably do a single treatment. It really just depends on what your intended goals are. So if there's a very targeted issue that on your skin that you're trying to treat, it might take a couple series of treatments. Otherwise, it could just be something that you do as maintenance to kind of keep that collagen firm and strong and toned.
It's not a promise, but I would anticipate that after you do your series, then it might be one treatment every 6 months to 12
Yeah,
months
that's
is
very
what
reasonable.
is what I would expect. And so you might say, oh yeah, okay, they're trying to upsell us, why do I have to do 3 treatments? So let me explain that to you. Let's go back to the putting green. It's been aerated by the microneedling, right? And so you see all these little holes. Well, does all those little holes cover 100% of the putting green?
Mm-hmm.
They don't. It's like pixels in a photo, okay? Funny, 30 years ago, nobody would really know what a pixel is. Now we're so techno-savvy, we know pictures are made out of pixels, right? And so what you're seeing is that you're maybe only treating a third of that area, okay?
Right.
So that's why you have to come back again in about a month
Mm-hmm.
and you treat it again. So what you're trying to do is fractionally, you're trying to treat the entire area. So that's the reason that we're going to do multiple treatments. So we do multiple treatments, and then I'm kind of guessing that maybe for most people it's one treatment every 6 to 12 months, and it really just depends, as you said, Jessica,
it's really
on their
dependent.
expectations,
That's
right, on
exactly
what
it.
they want. A combination. You mentioned that hyperpigmentation can be treated with microneedling. I think that's true, but for me, more effectively, if you're just looking at specifically, I have hyperpigmentation, I would recommend our BBL, which is broadband light, or intense pulse light IPL, photofacials, to treat pigment. And a combination of those two can really give you a great glow.
Oh yeah, that's really going to help target the pigment. BBL is intended just for those browns, reds, broken capillaries. It's going to go in there and really clean that up, and then the microneedling helps to improve the texture of your skin. So and both of them are collagen stimulating procedures. More so microneedling, but even BBL can give you a little bit of a collagen boost.
So Jessica, when you consult with people about photofacials or BBL, IPL treatments for pigmentation, a lot of times you mention tone, is that correct?
Yes.
Okay, so you're saying the tone of the skin is improved. What's your feedback from patients? Do they feel like their skin's a little bit tighter or their tone's a little bit better?
They really like the evenness of the skin. They notice kind of a glow and a little bit of a plumpness, and I see that in my patients. I call it the BBL glow because I think it just gives them a really nice even tone to the skin. Adding microneedling on top of that is just going to give you even a more amplified improvement in your skin and just the textural plumpness and firmness of the skin.
So I would agree with that, Jessica. And the way that I would look at this, if you're thinking, is if as a single type of treatment for pigmentation, IPL, BBL, photofacials is going to be the way to go.
Right.
You do get some benefit with tone. You do get some benefit with tone. However, if your biggest concern is tone and texture, then microneedling collagen induction therapy is going to be better for you. You get some collagen induction with IPL, BBL, but not as much as with microneedling. And so, as I mentioned before, it's usually combination therapy, which is going to be the best for you.
That's right. That's right.
So Dr. Tom, I have to ask, what other areas besides your face can you do microneedling?
Okay, so microneedling besides you can do it on your face. And by the way, this is very comfortable. I've had it done on me, okay? And I really like the results. And the next people say, well, what's the downtime? Well, the downtime is the next day I was here at KSRO doing a show, okay?
Wow.
And so it's not, there's no downtime as far as I'm concerned. Now, if you're somebody who's really sensitive, you might have a little bit more swelling, a little bit more redness, okay? But for me, I was able to just go right back to work the next day. And usually when I'm getting my treatments, it's after hours, and I can beg the patient, our staff, to do a treatment on me, and then I get a treatment. So that's the downtime with the microneedling. I want to make sure I answer your question as I kind of segued
sure.
off of it.
No worries. I was wondering about other areas.
Oh,
like the
other
hands,
areas. Okay,
sort of
other areas. So I was talking about being a weenie, and that yeah, that's right. I really segued off topic there. It's really comfortable. Maybe just a little bit spicy around the eyes and certain thin areas of the face. However, we can also put that topical anesthetic on other parts of the body, and the neck can be treated. It's a little bit thinner, so we adjust the settings, maybe on the chest, depending on the individual. The chest, the skin can be thinner, so we might adjust that. And also the hands, so the back of your hand. So besides face, we can do neck, chest, décolletage, if you will, and the back of our hands. And again, also that combination works well. So again, trying to improve collagen, and women will notice that because they might put sunblock on their face, or they may wear a hat, but they forget to put sunblock on their chest, okay? And even if they're not big breasted, just that change by having female breast projection, it gains more exposure to the sun, and so they tend to actually have more damage in that area. So sunblock, everybody. But definitely a combination of microneedling and BBL on that area would be a great treatment.
Nice. And is it sort of the same frequency for doing those kinds of treatments? As you do multiple treatments?
It would be the same. It would be the same frequency, right?
Okay.
So you're going to do one treatment, then in about a month another one, then another one, and then depending on your expectations, you go from there. So I love microneedling with PRP, and Jessica is one of our experts in that, and she's the one who would treat you with that. So tell us a little bit about our medical assistant, because we can talk about her because she gives us the okay. You know, we always have HIPAA and patient confidentiality. You know, so when Bridie went through this, and so tell me, what was her experience? And we're going to bring her on the show and have her talk about it herself. But what was her experience? Because she's, you know, she has a sensitive skin. She's a, you know, Irish girl, Gen Xer, all those kind of things. She looks great anyways, but amazing. You know, but what was her experience over the next 24 to 48 hours?
Right. So she was very comfortable during the procedure, for one thing. I just want to throw that out there. But immediately following the treatment, you're going to notice that your skin's going to be pink. It's going to be a little more pink, not like a sunburn, a little bit more pink, but that's what we expect. We want to see that we've gotten deep into the layers, so you're gonna have a little bit of pink skin, and after the application of the PRP, it's gonna feel a little tacky, almost like you kind of have egg whites on your face.
I think it feels amazing, actually. You feel like, oh my face might crack, but it feels so tight.
Yeah.
I love that feel. Okay, all
You
right.
may also notice a little inflammation. You may feel a little bit more swollen. It doesn't really appear that swollen, but you may feel that because it's that wound response. So your body's healing itself and helping to close those microchannels. So following the treatment, you want to go home after the treatment. We want you to do nothing to your face other than just leave that PRP sitting on there doing its good work. And then the next morning you wash your face with gentle cleansers and apply sunscreen. Sunscreen is a big, important factor.
So did she come to work the next day?
Absolutely.
She better have.
And she looked amazing.
Okay, all right.
Very little, just a little pinkness in her skin. She looked great.
Yeah, so she came back to work, and what day of the week did you do hers?
We did it on a Thursday,
Did
so
on
she came
Thursday,
back
so
to
she
work
came
on a
back,
Friday.
and we made her come back to work on a Friday, and she did
she
great,
was,
and she loved it.
Glowing by the weekend.
So I want to thank you, Jessica, for joining us
you.
today, talking
Thank you,
about
Dr.
microneedling. It's a great treatment for texture. It's collagen induction therapy, and our time's up, so I have to turn us back over to Michelle.
Wow, I always learn something great when you come in, Dr. Tom. That is Dr. Walter Tom of Dr. Tom Cosmetic Surgery offices in Santa Rosa, Napa, and Maui. Also online at drtomcosmetic.com. You can call and book your treatment at 707-542-8346, 707-542-8346. And about how far out are you booking for microneedling?
A couple of months.
Okay.
Well, actually, we probably get you. We've had, you know what? Call the office. We'll get you in as soon as we can.
Call the office at 542-8346. And there is a special. Purchase one area of microneedling with PRP and get a second area of treatment for free. Additional areas like we've talked about, the neck, chest, or hands. Thanks so much, Dr. Tom.
Thank you.
And thank you to
Michelle.
Jessica.
Thank you.
This is KSRO.